Hey, it's Dr. Charles Modlin, your friendly urologist, health equity leader, advocate. I'm back with another health equity brief. Today we're going to talk about tobacco exposure and the risk of smoking and some of the ramifications of smoking. Everybody's heard at this point in time that smoking can cause lung cancer, can cause other conditions, contribute to heart disease, peripheral vascular disease, all types of maladies can actually arise from tobacco smoking. But let me just give you some more information. Tobacco use, including cigarette smoking and vaping, remains a significant public health concern in the United States, especially among African American communities and populations. That's partly because of the predatory marketing that these tobacco companies utilize often in minority communities. So we're going to talk about some of the health outcomes, mortality rates, and consequences of developing related conditions, again, such as lung cancer, heart disease, and other conditions. So cigarette smoking as of 2019, about 15% of African American adults currently are cigarette smokers compared to 14% of white adults. I think those statistics are more stark and drastic. In certain populations, I know there's significantly more African Americans. I think up to 35% of the population smoke in Cleveland versus about 18% of white individuals. And the types of cigarettes smoked by African American populations, 95% smoke flavored mentholated tobacco products, which are more carcinogenic. Among youth, 7.5% of African American high school students reported cigarette smoking compared to about 5.8% of white high school students. Vaping, many people are misled about vaping. Vaping's become increasingly popular among youth in 2020. 21.3% of African American high school students reported using e-cigarettes compared to 19% of white students. Among adults, e-cigarette use is about 3.2% in African Americans, 4.8% in whites. So don't be fooled. The electronic cigarettes, e-cigarettes, are dangerous, just as dangerous and carcinogenic, cancer producing as conventional cigarettes. We do know that African Americans have a higher incidence of lung cancer compared to whites. Age-adjusted lung cancer rates for African Americans is 67.3 per 100,000 compared to 56.2 per 100,000 in white Americans. So you can see that's a huge disparity. Lung cancer mortality rates are also higher in African Americans, with a mortality rate of 48.2 per 100,000 compared to 36.1 per 100,000 in whites. We talk about heart disease. Tobacco is a major risk factor for heart disease. African Americans experience a higher prevalence of heart disease compared to white counterparts, with 46% of African American adults reporting cardiovascular disease risk factors. Mortality rate for Black Americans is significantly higher, 241.9 deaths per 100,000 versus 184 deaths per 100,000 in white Americans. You can see a pattern develop, a higher incidence of disparities and consequences of smoking in African Americans. Smoking is also associated with a number of numerous other health conditions, including COPD, that's chronic obstructive pulmonary disease, stroke, respiratory infections. African Americans are more likely to suffer these conditions due to higher smoking rates and even exposure to secondhand smoke. A lot of times people forget the consequences that individuals can experience having been exposed to secondhand smoke. We talked about the predatory marketing. There's some strategies that are being developed in different municipalities. Legislation is being espoused and introduced. I know in the city of Cleveland, there's some legislation pending regarding predatory marketing. I hope that pushes through. Tobacco companies have historically targeted African American communities through aggressive marketing strategies, including the promotion of mentholated cigarettes, flavored tobacco products, and they're marketing these e-cigarettes, tobacco products, even around our schools and to our adolescents. So mitigation strategies are requiring smoke shops, retailers to obtain a tobacco retail license. I know the city of Cleveland is considering that. City Councilman Kevin Conwell introduced legislation for the city of Cleveland to implement a tobacco retail licensing, banning flavored tobacco products. I read something last year that the entire country of Canada banned mentholated tobacco products. Banning flavored tobacco products. Again, the mentholated and flavored tobacco products are more carcinogenic. They're also more addictive. They can reduce irritation, and banning flavored tobacco products, including mentholated cigarettes, can reduce initiation and use among youth and African American adults. Flavored products are more often appealing to younger users. Removing them from the market can decrease the overall tobacco use. We need to educate our adolescents, our adults, through other additional community outreach efforts, awareness efforts. Again, we need to advocate for policy changes at the local, state, federal levels for tobacco, restricting the sale of flavored tobacco products, the use of e-cigarettes, restricting the predatory marketing. And so, I think this is an important health equity brief just to remind everybody. So I'm a urologist. A number of the cancers that we see in the urology, bladder cancer, kidney cancer, prostate cancer, are associated with individuals who smoke. Not exclusively, but if you're smoking, then your risk of these urologic cancers increases significantly. So that's my health equity brief for today. The importance of tobacco cessation, the importance of restricting the sale of tobacco products through tobacco retail licensing and other efforts, policy efforts, ending the predatory marketing that's been going on for decades in the Black community. I'll see you next time. And again, these health equity briefs are designed for me to have an opportunity to impart upon you important information I think that is necessary to help you individually improve, maintain your health and wellness and that of your family and community. See you next time. Please like, share, subscribe, spread the word about these health equity briefs. Thank you very much. I'll see you next time.